Hello, hello, hello. Hi, everyone out there. Where are my favorite super moms and boss moms out there? So, here's the skinny. I am at work. I had to do my Facebook Live at work today. I was having some difficulties yesterday with trying to do it. I may get some interruptions, but hey, that's the part of life, right? So, I am in the emergency department. So, I wanted to talk to you guys. It was really something that I wanted to talk to everyone about, and it was about common viral infections in your children that we're seeing a lot of. So, what I'm going to do is wait a second for Facebook to maybe populate my audience here and maybe see if we can get some more people on to chat or maybe have questions that I can answer while I'm on. So I'll give everyone a little bit of a minute here and see how everything's going. It's one of those beautiful mornings. I had some free time. Still waking up, of course, but I'm here to talk to you all. All right, so let's get everyone a little bit of a minute. Come on, come on, come on. Where is everyone? Okay, do I need to go around and show my audience, everyone here at work, and just show the department? Maybe so, of where we work. Maybe give people a little bit more time to come in. All right, we're going for a walk. Let's see who's over here. Good morning. Hi, everyone. I am on Facebook Live right now.
God.
So I thought if any of you guys would to say hi, Merry Christmas, then here you are. I
Merry
actually
Christmas.
turned.
Oh!
I turned the
Merry
camera.
Christmas! I am like the dingy blonde.
Could you stop it? This is Chrissy. She's one of our
Merry
amazing
Christmas.
nurses. As you can see, everyone else ran. So they didn't want to be on TV. Andrea's on. Hey, Andrea. Andrea says hi, everyone. Oh, now, okay,
Now
Desiree's
out.
coming out.
I'll say hi, Andrea.
Hi, come here. Peep your head out. Say hi.
Hi, Andrea.
She is on.
Come here. Here, I'm gonna hug her. I'm touching her. She loves it.
Aw. All right, I'm going.
Don't leave us.
All right, I'm going to go do my talk. I wanted to kind of show everybody who was here working with me today. Okay. That's my favorite bunch of nurses. They actually help me get everything taken care of. We save lives here every minute at a time. That's what it's about. That's living the pediatric ER life and being in pediatrics. And it's just a part of just what we do and what we enjoy to do. So, I'll be sure to tell her, Andrea, that you said hi. I kind of came back to my little cubicle here so I can do my discussion. So, let's get a little bit started. So, if anybody doesn't get a chance to see this, you can catch it on the replay. So, let's just start. Once again, let me just kind of reset here. It's your favorite pediatrician and Dr. Mom, Dr. Tamika Peds. I am here to help moms like you and me keep your children happy and healthy, all naturally, without the use of conventional medicine. And so one of the things I want to talk about today is we're talking about common viral infections that we're seeing in the emergency department today. One of the things that we are seeing a lot of, and these are things that I want to kind of go over some of the symptoms and then kind of make sure whether or not you all know when to bring your child into the ED or take them to the doctor if there's any concerns. So one of the first common viruses that we see, I don't know if everyone knows about, it's called RSV. RSV is basically respiratory syncytial virus, okay? This is the infamous virus that you guys hear about on the news that are affecting newborns all the way up to 2 years of age. And it's very common at this time, usually from November to March. and it affects the little babies, even like the preemies, the little itty bitty babies. And the sad part about it is, for us, it's like a common cold. Like we can get runny nose, congestion, but we don't have as much as the breathing issues and all the complications as you would if you were younger. So some of the symptoms that you may see, it could be something as a low grade fever in your little one of 100.2, 100.1. You may see some runny nose. You may see some congestion. You just may see to where they're not feeling well. They're a little bit more clingy than usual, or perhaps they're not wanting to eat as much. All of those things are signs and symptoms of respiratory syncytial virus. Now, remember, it can only happen from birth to 2 years of age. Now, one thing with this RSV virus, it is the most common wheezing associated virus in our kids. So if you have your little one, and it doesn't mean that they have asthma or anything like that, but if they have any cough, any congestion, and they're wheezing, and you're worried about their breathing, do not hesitate to take them in. Now, what would make you worry clinically is, say if they were working really hard with their breathing. Say if they, you kind of saw their muscles kind of go in and out, and you could see their ribs, and you think they're breathing too fast. That's an indication to take them into the doctor or the emergency department to get seen. Another instance would be if they're not tolerating their feeds, if they're vomiting their feeds because of the mucus and the cough and the congestion, and you're worried about them being dehydrated, you want to take them in. Now, a third thing would be if they have a fever. If the fever is 101 or higher, that is something to be considered about, especially that's not normal in a 6-week-old or less. You want to make sure there's nothing else going on that could be serious. So you definitely want to get them seen by somebody medically. So those are some of the things that you want to worry about if they have the RSV virus. And it would make you want to go into the emergency department or get followed up by their primary care physician at that time. Now, you're wondering, how can you diagnose it, right? Well, the only diagnosis is usually, we can do testing. We can do a nasal swab for testing, but a lot of times it's diagnosed clinically. There's like no special x-ray. There are x-rays you can do that look like a certain picture of bronchiolitis. Oh, bronchiolitis is, in other words, it's synonymous with RSV. So if you hear your pediatrician say, oh, they have bronchiolitis or they have RSV, bronchiolitis is like an RSV type syndrome, and it's a wheezing virus associated syndrome. So RSV is actually when you actually test positive for the virus. Now, in order to test positive for the virus, you have to have a nasal swab. So basically they have to get nasal secretions of your little one, and they have to send it off and do a test. And if it's positive, it will test positive. Now, what is the difference you're trying to say? Well, they're both going to cause the same symptoms, whether or not bronchiolitis or RSV. But if your infant has RSV, you're going to be looking for a more complicated course. Complicated meaning they may have waxing and waning or ups and downs to where they get to a worse point where they're not wanting to feed or not doing well. And if that's the case, then you definitely want to just make sure you keep follow-ups with your PCP or your pediatrician every 2-3 days, just to make sure that they're going to be doing fine. So that's a little bit on RSV/bronchiolitis. One of the other things that we're seeing a lot today in the ER is it is croup season. Croup. Does everybody know what croup is? Now, croup is also another virus. It is caused by the most common parainfluenza or flu virus, and it can be caused by other different types of viruses too, like RSV. Viruses they mutate so much, so there's like so many different viruses that can cause different colds and infections, which is why there's no antibiotics to treat viruses, because they mutate and they change. So the best way is just supportive care, fluids, hydration, making sure you keep the temperature down, making sure your child is eating, all of those things, because you can't treat viruses. Your body's just going to have to build the immunity to kind of fight back those things. So croup is another one that we see. Now I'm going to do some scenarios of what it sounds like, so it may seem a little funny, but I want you parents to understand, and you moms to understand out there, if your child has any of these symptoms, this is something that could be alarming. Now, croup is basically when you get inflammation just of your upper airway, and upper airway is usually up here. Okay, and what happens is it makes a gurgling sound. Some of the kids are hoarse. They may have a hoarse cry, or for instance, they may have a barky cough. And when I say a barky cough, the cough sounds like, "Ooh, ooh, ooh." So that cough could be like a barky cough. And what happens is that cough kind of comes out the blue. And you may not ever like hear it until the middle of the night. And that's a lot of times when we get most of the children. And it's usually like at the wee hours of like 2 in the morning or 11 o'clock at night. And they wake up just with breathing fast, that barky cough. And they may also have something for what we call medically a stridor. A stridor sounds like this. And those are things that you want to look out for croup. You got the croupy cough, you have the stridor, and you get the hoarseness. Now, the treatment. Now, there's 2 different types of treatment. One of the mainstays is steroids, and steroids help to decrease the inflammation within that area here in the upper neck that's causing those noises, so that neck doesn't build up with mucus and lead to worsening breathing. And if that's the case, you want to have them seen by a pediatrician or the ER, because you want to make sure their oxygen level is okay. So steroids is one. The other one is sometimes you can give treatments, breathing treatments. Breathing treatments can also help open up the airways so your children can breathe better. Another cheap way, and also easy, instead of you put the kid in the car and drive them all the way to the doctor, is taking them outside. Cold air. Sounds a little crazy, but it actually works. Taking your child outside on the porch, letting them inhale some of that cold air, have them bundled up. The cold air actually helps to decrease that noise, help with the breathing. And it's weird. It's kind of like the opposite for asthma, right? Because asthma, you don't want to take anyone out into the cold air. But with this croup virus, it actually helps. Some argue that steam mists or steam showers helps. I found out that with a lot of my patients, cold air is definitely amazing for this virus. So that is something you want to kind of try first. Or what I noticed too is most of the parents will end up coming into the ER after the kid woke up with problems breathing. And then what would happen is they'll be fixed because the car ride, because it was cold. So definitely trying some of those things. Now, the symptoms would be runny nose, cough, congestion, similar to bronchiolitis. You know, a lot of things with these viruses, there's not much that defines differences between them. A lot of them are going to look like colds. So it's different things. That's why I'm trying to point out different things for you moms and parents out there of what to look out for, of when you should kind of bring them to the ER or take them to the primary care doctor. Now, the other third virus is the common cold. Yeah, that's basically runny nose, cough, congestion, sneezing, sore throat, all of those things. And it's caused by the most common virus, rhinovirus. So there's different types of viruses that can cause the common cold. I'm not going to go into the spill medically. It's coronaviruses. It's just so many different types. So common cold is not going to have a lot of the features as far as worsening breathing issues as bronchiolitis or RSV or croup. But one thing with the common cold is your body will heal itself, and it just takes time and supportive care. But you have to watch out for those kids that have asthma. Now, those children that have asthma can get a flare-up of their asthma if they have any type of cold or virus. So if that's the case and you're seeing that you're giving your child albuterol, or if there's any concerns to where you're worried about them breathing, do not hesitate to take them into the emergency department to get evaluated and make sure their oxygen level is okay. All right, the final thing we're going to talk about is flu. Yay! Okay, so we have been seeing some positive cases of flu. And we have been seeing a lot of things in the ER, which are flu-like illnesses. So we've been seeing some children that have been having flu-like illnesses, which means they've been having temperatures of 104, 105, in addition to runny nose, cough, congestion. And flu can be seen as young as 4 weeks. Yes, you do not want your 4-week-old to get the flu, because imagine when you get the flu, you feel like you've been hit by a Mack truck, right? Right. So you do not want your kids to have the flu. But we talked about this in my previous discussion on ways to prevent flu, and if you guys didn't get a chance to catch it, it's up on my Facebook fan page on @Dr. Tamika Peds. So definitely check it out about ways that help and prevent your child from getting the flu. But flu is something that there's no treatment for as well. It is a very common virus. It presents with runny nose, cough, congestion, sore throat, fatigue, decreased appetite. You can have body aches, just really just tired. All you want to do is sleep. You don't want to eat. So in those cases, you just let your child sleep. Make sure they stay hydrated with fluids. If they don't want to eat, it's okay. They'll slowly get their appetite back. You want to treat the fever. If they have a high fever, you want to give ibuprofen or Tylenol to treat the fever. And then if there's any concerns that you are worried about, then you definitely want to follow up with a pediatrician. So, those are some of the 4 common viruses that we see here in the emergency department. We talked about to reset. We talked about RSV, we talked about croup, we talked about flu, and we talked about the common cold. Now, here's a little extra. I did talk about all natural ways to kind of help boost your immune system. And just to kind of let you guys know, these are things you can still do. One thing you want to do, if you're a mom that's breastfeeding, breastfeed if you can. That's really important because those antibodies that you have through your breast milk will help your infant, and it will reduce the amount of colds and cough and infections that your infant may have. And if you got the flu shot, all those antibodies will be passed on to your infant. So if you can breastfeed, definitely try to breastfeed. If you can't, do not feel like it's the end all be all, because it's not. What you can do is practice proper hand washing techniques, disinfecting the surfaces, all of those things. You want to take in vitamin C. We talked about vitamin C, vitamin D. All of those things are going to help boost your immune system. Probiotics. Your gut is your main site for your immune system to keep it strong, to keep it healthy. You want to take probiotics. All of that's going to help. Eating a good diet of fruits and vegetables. All of those things. So all of those things will help kind of keep your immune system up to hopefully help you prevent from getting sick and prevent it from passing through your family and through your illnesses. Passing through your family and spreading it around through everyone in the home. So trying those different techniques, all of those will help. So I am going to get back to work. I hope you guys have a fabulous Friday and an even wonderful Merry Christmas and Happy Holidays. And I just wanted to share with you a couple of tips for when to take your child in if they have some type of virus or cold and infection, especially with this holiday season being around family and friends. So once again, it's your favorite pediatrician and Dr. Mom, Dr. Tamika Peds. You all take care, and I'll see you next week. All right, bye.